Take a look at this amazing transformation. A historic procedure revealed in New York today. It is what doctors are calling a medical milestone.
A face transplant for a volunteer firefighter who'd been terribly burned. CBS 2's Dr. Max Gomez tells us of the amazing surgery and its results.
It was a routine fire, if there ever is such a thing, in Senatobia, Mississippi back in September 2001. That's when volunteer firefighter Patrick Hardison suffered third-degree burns over all of his head and chest. 14 years later, Patrick found himself in New York, waiting for the most extensive face transplant ever attempted.
They're working hard every day, trying to get this transplant done, so hopefully it's not much longer.
Dr. Eduardo Rodriguez would lead the team of more than 100 medical professionals at the NYU Langone Medical Center. But finding a donor that matched Patrick's general appearance, blood type, and other tissue factors was not easy.
He was a year on the wait list, and he was the only person on that wait list. He wasn't with others, and it still took a year.
That donor was David Rodabow, a 26-year-old artist and bicycling enthusiast who died after a bike accident in Brooklyn. Surprisingly, the primary goals of the surgery were medical more than cosmetic.
The biggest functional improvement was in the eyelids, and then, of course, removal of the scar for normal facial animation.
The 26-hour operation began August 14th in adjoining operating rooms at NYU. The donor tissue included not just the face, but much of the neck skin and even several facial bones. Most importantly, blood vessels and nerves had to be saved and reconnected with microsurgical techniques. Patrick's swelling and appearance have gradually improved in 92 days. Here, Patrick is waiting for his children to see him for the first time.
I was excited to see them. I'm excited to see them.
Patrick's appearance and his vision are dramatically improved from his post-burn condition and will continue to get better. But what's it like looking at another person's face in the mirror?
They will tell you that it's them. What they see is the way they were before.
And so far, Patrick has not had any of the rejection problems that have plagued other recipients, face recipients, in the first 90 days post-op, but he will have to continue to take anti-rejection medicine for life. In about 3 months, Patrick will have some touch-up surgery to remove excess tissue around his lips and eyelids, which should also improve his eyesight, speech, and swallowing. But he actually has movement in his mouth, his eyelids, and sensation, and as the nerves continue to regenerate and grow into the tissue.
That just takes your breath away.
Isn't that amazing?
Beyond incredible.
There is like no words, really. It is amazing.
Something that is hard to describe to something that's even harder to describe in some ways, the improvement.
And this has been going on, this type of surgery, for what you say, 6-7 years or so?
Yeah, exactly. There's been about 24 of these done worldwide now, but this is the most extensive one so far.
Wow.
And I love how the doctor said that they see themselves. They see themselves still after all of that.
It's not like Hollywood where they see somebody else's face in there. They see themselves in the mirror.
Incredible.
Incredible. Thank you, Doctor.
Thank you so much.